Hi everyone, welcome back for part 2 of our lecture on the psychodynamic perspective on personality. We left off on slide 8, Freud's psychosexual stages, which of course is the weirder part of it. So I'm going to explain, and this is very nice to just be able to record versus having to explain and say these things in front of you in person, because we're required to cover them as part of Freud's founding theory, even though most of it is not believed today. So let's get started. He argues that in childhood there are stages of development, which people agree with. His argument is that during those stages, it's basically driven by the id. So remember, the id is your internal pleasure-seeking part of your personality, where you just want gratification. He breaks it down into 5 different stages, and they all have different parts of the body to focus on, and it is, again, about seeking pleasure. So he starts with the oral stage, which is 0 to 18 months, because that's when babies put everything in their mouth. We understand today that that is basically how they intake most of their information, because their motor skills are not as refined, nor is their eyesight. But for Freud, he thought that babies get pleasure from chewing, biting, sucking, and he argued that with each stage, you can have a conflict that will then later be manifested in your personality as an adult. So if there was a conflict during the oral stage, that's when you can have issues as an adult with it, like if you've ever heard of like an oral fixation, which is no longer argued, but like people who always chew on their pens, or constantly have their hands in their mouth prior to corona. The argument was they probably had a conflict with weaning, so that's when you stop taking a bottle or breast and you start feeding out of a cup. If it's done too early or done too late, or done in poor circumstances, that can all be a conflict. So that's his first stage. His next stage is the anal stage. So this is 18 months to 3 years, and it's all about pooping. Gratification comes from bowel and bladder function. Basically, it's good to poop. And obviously the conflict here is going to be potty training. Same deal. You train too early, you train too late, you train too harsh, okay? And that can cause issues with control. So if you've heard of someone being anal retentive, which again is pop psychology, it's not a real thing anymore, but that's someone who has to have control over everything, and that comes from, according to Freud, their potty training days. He gives variations on the phases based on time, but I can personally say that time doesn't mean anything, because you have kids that will potty train when they are 3 and others who will not and act like you are going to change their diaper for the rest of their life. And they say, no, I won't use the potty. You can guess which one it is. Then you have the phallic stage. So that's 3 to 6 years old. That's when your pleasure zone shifts to genitals. You realize that good feelings come from those areas. And again, not believed today. But it's understandable how Freud would have come up with that, for anyone who knows at the very least, a 3 to 6 year old boy, because their hands are always in their pants, no matter how often you ask them to not put their hands in the pants, or whether or not they're in public. It doesn't matter. It's their favorite toy. You also have some further interesting parts of Freud. This is where he's going to come up with a very famous complex, the Oedipus complex. He's going to push forward as a big thing. So if you know the Greek tragedy of Oedipus, he accidentally marries his mom. So for the Oedipus complex is a boy dealing with the love towards his mother, and how you just really love your mom. Okay. And if that is not reciprocated, or something prevents that, that's when you can have a conflict. Freud does not talk about women basically in all of his arguments and study, which is interesting because all of his patients were women. But obviously in Freud's mind, lesser beings not as complicated as men. So he does not include the opposite for any of these genders. It's just about males. Later psychologists who are building off of Freud's work will come up with the Electra complex. Again, Greek tragedy. This case, she marries her dad. And the exact same thing. You're really in love with your dad, and conflict can happen if that's not reciprocated. Okay. Then you'll enter the latency stage. This is 6 years to puberty. This is your gender identification process. So this is when the focus of the child's attention shifts away from the opposite gendered parent to the same gendered parent. And obviously gender identity would be a conflict in there. Again, it's interesting because there's absolutely nothing it's not non-understandable, because Freud, at the time he lived and who his patients were, which were all housewives, there wouldn't be an instance of this, but there's no accounting for single-parent households or same-sex parent households where there isn't a same gender to identify with. If you went off of his argument, anyone who didn't grow up with a same-gendered parent would then not identify as that gender, which we know is completely untrue. But again, Freud says a lot of stuff that's later proven false, but psychology is too young for us to stop listening to Freud. So after that point, when you have identified your gender, you'll enter the genital stage at puberty. And that reaches from puberty to adulthood, where you start to begin experiencing sexual feelings towards others. And obviously the conflict there would be if your feelings do not match with societal expectations. Yeah. And like I said at the very beginning, the conflict in all these items leads to fixation later in life, issues later in life, and again, that whole idea from Freud that everything happens in your childhood. The next slide is just from your textbook to give you more clear examples. Yeah. So let's move forward. So after we finish with Freud and people start to question his work, thankfully, you'll get a group called the Neo-Freudians. So the Neo-Freudians agree with some parts of Freud's argument and disagree with others. So they're not a completely different perspective. They just have updated versions. So let's talk about a couple of them. You have Alfred Adler, and he says, yes, childhood experience have a massive influence on your adulthood. However, he doesn't think it's about sexual tensions, thankfully. He says it's about social tensions and whether or not you are getting that approval or disapproval from the society around you, most likely your parents. Okay. He also says he'll come up with the inferiority complex, so problems focusing on feelings of inferiority. Basically, that's when you get people who have aggressiveness or overconfidence as a way to deal with feelings of being less than others. You've heard of like overcompensating for something because you don't feel you're good enough to meet the standards of society. So you are constantly overachieving to fulfill that. Okay? And it's understandable how that could be done in a childhood, so you always worry that you're less than what is needed, so you continuously push for more. Then we have Carl Jung. He agrees with the non-focus on social factors. It's more about you, it's not about other people, but he argues that it really is more about the individual and less about the other people around you. He has this idea that it's really about your unconscious, what's happening internally, which Freud agreed with. But he believes that people have what is called the collective unconscious that connects us to our ancestors. Okay? The idea that there are universal symbols and understandings that is just inherent in people, and they connect to them as need be. He's famous for bringing up the concept of archetypes, which is what your assignment will be about today. Archetypes are just how you see yourself and how society sees you and what roles you play. And you can have different archetypes for different events in your life. If you look at television and film, which is what you'll do in your assignment, it's very easy to demonstrate who archetypes are. Like, that's a villain, that's the hero, that's the comedy relief, that's the love sick person. All different. He is not really followed today. He's discounted by most modern psychologists. However, we do accept that there is universal behaviors based on evolution, which we've talked about before, being afraid of the dark or loud noises, or even snakes, like things that would have helped our ancestors survive but don't really affect us today. Okay. Then you have our last one we'll talk about is Karen Horney. She agrees with the psychoanalysis premise that you can talk to people and then analyze what they have said to learn more about them. However, that's about it. She says, number one, what we all know, male-dominated theory. The argument by Freud that female development was inadequate to be able to psychoanalyze is just ridiculous. And she argues that social variables, not biological variables, determine personality. It's all about societal expectations, not anatomy. Someone who grows up in one area could act very differently than someone who grows up in another area. Okay. All right, so moving on. Assessing personality. So we needed to come up with types of tests to help us reveal the unconscious. Like I said, Freud used dream analysis. He called it the royal road to the unconscious. And we talked about how that's completely subjective. Okay. A lot of what will be developed are projective tests. Remember we talked about projection as a defense mechanism. So this is when you use ambiguous stimuli, so things that don't mean anything, to trigger the subject's inner thoughts and feelings, to trigger them to place meaning upon it, and that's what you would analyze. So examples are the thematic apperception test, TAT. And when we watched The Scout, you saw an example of that. So that's when you hold up a picture and you say, tell me what's happening in the picture. And someone says, well, the woman's crying because she just lost something and it's terrible. And then like someone else says, she sneezed. And it's clear that the second person has an issue. So that's one where you look at the pictures and explain it. The other that you might be very familiar with because of pop culture is the Rorschach test. And those are the ink blots. It is the most widely used test. It is a set of 10 ink blots that have been patented. Anytime you see an ink blot test on TV, it's not a real Rorschach test. They keep the image is kind of hidden. It's an interesting test because for a long time it was assumed it really was pop psychology, because everyone got different results. But what's very interesting, if you watch the little video, you'll see that when Rorschach developed it, he created a very strict set of guidelines that needed to be followed, and he collected a lot of data to prove that it worked. And when you go back and you review his data alone, it actually does work. And then people have been arguing to try and reinstate the test with those guidelines to get more information versus what people are using, which are just subjective tests where any therapist can decide what it means. Okay. All right, so evaluating the psychodynamic perspective, let's talk about what we think about it. For the most part today, okay, number one, pretty much everyone, almost everyone, most do not agree with Freud's focus on sex for the basis of personality. Number two, nobody uses oral or anal as classifications anymore. Okay. Number three, again, most do agree that a large part of our mental life is unconscious. So something people agree on is, yes, it is not just what you are thinking, there is underlying factors. Then number four, we do agree that we struggle with internal conflicts between what we value, what we want, and what we fear. And that would be what Freud explained as that ego managing the superego in the id. And then the last one, most people agree that childhood experiences do shape personality. However, it doesn't, it's not the only factor that shapes your personality. So your past does affect your present, but it's not the only factor. And the last one, just because I really want to make sure that you fully understand that we don't listen to most of what Freud says. So here are all the issues with his work. Number one, like I said, almost all of his research were upper-class Austrian women in the early 1900s. Okay, that is a very small subset of people. Number two, we can clearly see that development continues throughout life. Having a bad childhood does not guarantee that you're going to have a bad adulthood. Number three, gender identity is not linked to the Oedipus complex. Massive studies done about that in modern times. It's not a conflict issue. Four, it really underestimates peer influence on personality and overestimates parent influence. It's understandable if most of the patients you were talked with were talking about their children. And what effect the parents would have, because that's what you get. But in reality, especially you teenagers, know your friends can have a much greater influence at many times of your life. If we talk about it biologically, another issue we have is that lots of neurological studies have shown that children under the age of 3 don't have the physical brain capacity to store the kind of emotional trauma that Freud described, where it could be long-lasting and forever detrimental. You can have trauma, and it can take a while to help young children deal with that trauma, but it is not something that once it happens, their life is ruined forever. Again, we've talked about before the use of leading questions. So his whole psychoanalysis is about the therapist asking questions. We talked about leading questions and how that creates false memories when we were talking about eyewitness testimony. Clear focus on male development. Again, even though all of his patients were women, all of his assertions were about men. And the last one, because remember, psychology from the very first day of class is in fact a social science. There is that science part of it. You have to be able to experiment. You have to be able to reproduce results in order for it to be valid. And this theory is not scientifically valid. There is no way to test. There is no way to reproduce the results because it's all about the therapist analyzing the results. There's no rubric to follow where everyone does the same. There's just so many issues with Freud's work. But again, psychology is fairly new. He's one of the major founders, and he's also interesting, to say the least. So that's finishing our lecture on the psychodynamic perspective on personality. You'll see your assignment is the archetypes. And like I said, archetypes are basically those fake personalities you put on at different times of your life and different situations to deal with it. You are going to use film or TV shows, and give me the list of characters and what archetype they are filling. And they could have multiple archetypes. If it's one of those shows you're really into and you notice how they change all the time, they can fill all sorts of things. Okay, so you can do that in just a straight list format. So give me the name of the show or the movie, and then the list of characters. It doesn't have to be every character, but the main characters, and then what role they fill in based on that. And I gave you the archetype wheel on the Google Doc, so you already have a bunch of those examples of who they are. Okay, and as always, email if you have questions, and I will see you next class.